but I'm very, very happy to have Rick Glassman here from the Disability Law Center. He's the director of advocacy over there. And I think, you know, through the ARC, a lot of you know the Disability Law Center's critical role in passing Nikki's Law. And we were extremely lucky to partner with them on that legislation, especially when we got to due process, Rick, and CPCS and all that fun stuff. So you guys were lifesavers in working through that with the legislature and with that particular agency. So, but there's so much more that the Disability Law Center has done over the years, and Rick himself has been a true champion for housing discrimination issues and restraint and seclusion in schools and access to services and supports in our community in integrative settings and fair wages and so much more. So we are incredibly lucky to have him working for our community. And I want to turn it over to him to give you sort of an update on what DLC's been doing during COVID, or anything else that he thinks is a priority right now to talk about, and kind of where we're going, you know, hopefully in the near future, and working with the ARC as well. So Rick, I'll just turn that right over to you.
Great. Thanks, Maura. Thanks for inviting me to drop in. It's nice to see folks and be able to chat for a few minutes with you. And Maura, I'm going to talk just a little bit about what's been going on with COVID and some of the other work going on in the office, but feel free to jump in and hope we can have a conversation. So as you probably already know, DLC works a lot with people with intellectual and developmental disabilities. And I think when I think of the best work in our office, it's always in the form of collaboration, particularly with grassroots organizations, organizations of people with disabilities and family members, places like the ARC, MFOFC, and others. And we really enjoy that work. And we try to see ourselves as the legal arm of both self-advocates and families that are trying to assert their rights. So, as you might know already, our work is really varied. In addition to a lot of work we do with people with intellectual and developmental disabilities, we also work with people with mental health issues. We do work in facilities, health and benefits, assistive technology, housing, employment, public accommodations, other civil rights issues, and a lot more. We also do cases around financial exploitation and issues around representative payees. So there's a lot going on our plates. There's only about 11 lawyers. There's about 803,000 people with disabilities, about 300-something thousand people with cognitive disabilities. So there's a lot of work out there, but you know, a lot of what we try to do is think about what will help the most people. So in addition to doing individual cases, we also look at big systemic issues and try to partner with groups like the ARC so we have the biggest impact possible. So just a couple words about what's been going on with COVID, and then maybe we can take some questions from you about what you think might be particularly important for us to think about. Like a lot of us, since March, we have kind of dropped into another world, and we've been working full-time, all hands on deck, trying to deal with COVID issues. And in the early days, March and April and into May, a lot of it was very much emergency-driven work having to do with infection control in large congregate settings, the ICF IDDs in DDS-funded group homes, as well as mental health settings and nursing homes. And so we were dealing with issues like testing and separating people who are positive versus negative, or making sure people have masks and gloves, and dealing with staffing issues. We spent a lot of time and are still working on the issue of visitation when people end up in hospitals and they need a designated support person, and the hospital rules about visitation excludes family members. So we have worked a lot on that. We've worked on visitation in group homes. And then there's a lot of other COVID related issues that we've dealt with. I worked with people with lupus who couldn't get their medication because there was a run on a medication called hydroxychloroquine. You may have heard about in the news. So there was a lot of emergency driven work in those early months. And now I think we're starting to deal with a different second wave of COVID related work. People who are going back to work who have issues, health issues that may prevent them from doing so, who need to work at home, housing evictions that have to do with people who have lost income or otherwise need accommodations related to COVID, healthcare access and telehealth related to COVID, people who can't wear masks for disability related reasons, people who are in facilities and suddenly are locked down and they can't get access to fresh air, or they can't get discharged even though they're trying to, they're able to be discharged. People who can't get into the group home setting that they need to, or can't have visitation from families for COVID related reasons. So there's a lot of things that we're dealing with now that are not as emergency driven, but they're really important. And finally, I'll just say something about two issues that we have worked closely with the ARC on that I think are especially important. One has to do with what are called the crisis standards of care. Those are the rules that govern rationing of resources. So what happens if you don't have enough ventilators or enough ICU beds, and this is happening now in Arizona and Texas and Florida. And how do you ration a limited number of resources, and who gets resources and who doesn't? And we have been particularly worried that people with intellectual and developmental disabilities will get pushed to the back of the line. Many folks have complex medical conditions, and the first set of rules would have excluded anyone who had a life expectancy that might have been whose long-term life expectancy might have been affected by a medical condition. And now the latest set of rules, which we still don't like, could exclude or push to the back of the line people who have a condition that might affect their life expectancy over 5 years. And so Maura and Leo and I and many other disability and civil rights advocates have been working in a coalition with the Center for Public Representation to try to get the state to change those rules so that anybody who could be expected to benefit from a ventilator or an ICU bed or something like that and could survive having COVID would be able to get those resources. And that is, that's not something that we're facing right now, thank goodness. But as I said, many other states are, and we're trying to brace for the possibility that it could happen again, that we will have another surge here. And so we want to have rules in place that are fair to people with disabilities, including people with intellectual and developmental disabilities. And then the other thing that we're working on with the ARC right now has to do with dehabilitation. And for a long time now, about 2 years, we, including Hillary Dunn, an attorney in our office, has been working through a grant that was originally funded by the ARC and what's called the Becker Trust to look at dehabilitation, where there's about 9,000 people that are in largely segregated conditions and don't often get into the community. And so right now, as Dehab starts up again, we think this is a good moment to take a long, hard look at why Dehab is so segregated, why people don't get time in the community. It's common for us to hear that people may get out from a Dehab facility maybe once or twice a month, and that's all. And so we're asking, why is this program still segregated? Now that it's reopening, maybe it's easier to change it as opposed to chase a moving target. And we know that congregate facilities where there's a lot of people packed in closely together are not really safe because of COVID. So maybe there's another way to do that. Maybe we can fund some pilot programs. And so that's something that we're collaborating with the ARC on. And if you're interested in that, I hope you can reach out to us and we can work with you on that. That's like a quick overview of some of the most important things. Maura, is there anything else that you would like me to highlight in particular?
Yeah. Well, I would just jump in on those two last points where you were talking about the collaboration with the ARC. And yesterday I was on a call I was lucky enough to take Leo's place because he had another important call, but I got to go on a call with Center for Medicaid and Medicare Services. And many states across the nation that are affiliated with the ARC are talking about reinvention of day programs right now and day habits because of exactly what you said. And some are feeling extremely committed to not reopening in the same way. And so we talked a lot about the retainer payments that we're hoping to get funded through the federal government to really focus on reinvention. And obviously, we've said in this webinar in the past that day programs need to be stabilized. I mean, that's the first thing. So nobody's talking about, trying to take money to make changes before we even know if they can open their doors. But as we move forward, I think there is a great opportunity, and working with you guys will be fantastic on that. All the pre-work you've done, and I think it's just a really but we really do need to stabilize that and do that work simultaneously, I think. So we're very excited about it. And the only other thing I was going to say about the crisis standards of care is I mentioned this last week because we talk about it pretty much every week, that our meeting with the Secretary of Health and Human Services went really well last week, and out of that meeting we were able to file an amendment to the healthcare bill that is actually, I think, being heard in the House today. And so Rep. Garbely has filed that to address the need for training of our hospital professionals. And that really came out of that coalition work that we did. And as well as the incredible amount of work you guys did on the accommodations and allowing people to accompany their loved one. But I just wanted to put a personal perspective on the crisis standards of care from how you described those underlying conditions and how that could affect an individual with IDD or autism. So for example, my son Neil, he is diagnosed with a very serious disorder called mitochondrial disease. And he also has somewhat uncontrolled epilepsy on top of his autism. And the original crisis standards of care really would have put him in jeopardy if he came in very, very, very sick, even though he's of young age. He's 19. Because, and this is a real significant detail, Rick, and you can correct me if I'm wrong, but over 18, the triage and the care team did not have to consult with experts in, say, mitochondrial disease or epilepsy or his history. They would be making decisions based off of those diagnoses. And so it was super important that we were effective in making changes around those underlying conditions, not taking priority in terms of how they decided on triage and treatment. So personally very relieved that we have made so much progress in that way, but I thought that just gives it a little more context in terms of how our folks are affected.
I think that's a really important point, Maura. You're absolutely right. They would not have to assemble specialists, or as it's written now, or some sort of multidisciplinary team for people over 18. And so what you end up with is people in the emergency room setting that are in a very rushed way. And people, we're talking about healthcare in fairness, I want to say that these are healthcare professionals that never want to be in this position and are doing the best they can. So I'm not trying to criticize them at all. Most of them would never want this responsibility, but they're being given it, and they don't have the tools to exercise these judgments they're being asked to do. And in fact, they are telling us and telling the state, we can't do this. We can't make snap judgments based on 5-year life expectancy. And so when you ask doctors to do things that you are not equipping them to be able to do, you invite implicit bias, you invite stereotypical assumptions about the value of life, particularly when we're talking about people who have been stigmatized, people with intellectual and developmental disabilities that are often not well enough understood by the medical profession. It's not a good situation. And the rules just pick up people, 5-year life expectancy is very generalized. I mean, I'm a cancer survivor. I have chronic kidney disease. I have only one kidney. I would get points onto what's called the SOFA score and get pushed to the back of the line. So, there's a whole wide population of people who have different kinds of chronic conditions, including many folks with intellectual and developmental disabilities that would not fare well. And so that's why the ARC and DLC and so many others have been working so hard to try to fix this.
Appreciate that.
I wanted to go back to what you said more about looking at other states and DAHAB. I think one of the things people should be aware of is, we have a lot to be proud of here in Massachusetts. This community has worked really hard to get us to where we're at. We have a lot of really good vendors, but we do have a tendency to think that we're like at the front of the pack of everything when sometimes we're not. And in fact, many other states are further ahead in integrating DAHAB already than we are, partly because we have relied on what's called the state plan instead of waiver services. And that distinction doesn't mean anything to you. We don't have to get into the weeds about it right now. But the point is that it's a different way of funding, and it's had some good things and some bad things associated with it. One of the good things is that people who need DAHAB services have been able to get them and not be on a waiting list. But one of the bad things is that there has not been a focus on community integration up till now. And there really has to be because of what's called the HCBS community rule that's coming down the pike because of the ADA. And because, as every family knows, their loved one will learn more and do better in DAHAB and generalize the skills in DAHAB when they're taught in a more integrated setting. That's what families tell us. That's what the literature tells us. So putting people in a closed facility and expecting that daily life skills, ADLs, and so on are going to be able to be generalized is not realistic. So we can do better by our loved ones and family members if we provide more integrated services, and that's what the law requires, and that's what we've been trying to do. And so our work at DLC has been, with the help of the ARC, has been about listening a lot. We spent a lot of time interviewing family members, collecting data, doing online surveys, going out to DAHABs and meeting with vendors. I mean, there's a ton of places, a ton of data that we've collected, a ton of stories, a lot of experiences from both the vendor side and the family side. And we're trying to have a collaborative conversation among all stakeholders, including Mass Health, the ARC, and so many others, to figure out how can we make this system stronger.
It's just been an extraordinary amount of work for you guys. And I want to open it up for questions for Rick. And any more you want to share about that work you did and kind of some of the outcomes or the points that you've come from that. But go ahead and unmute because we don't have anything coming into the chat. Oh, yes, we do. We have Jassy has a question. Does DLC funding come only from the DD Act, or you're also funded by the state? And would you be covered by Don't Cut Us Out? We
get, as what's called the protection advocacy system. That's a designation for one type of organization in every state. We get funding through the DD Act to work with people with intellectual and developmental disabilities, and then there's other pots of money for other types of groups, for people with mental health issues, for people with assistive technology needs, for people with physical disabilities. And then we get a little bit of money from the state, which is through the Mass Legal Assistance Corporation for low-income people, which can be used in a variety of different ways. And then we get some money through the state to assist victims of crime. And so there are many people who are victims of crime who have legal needs that come out of that. It may be somebody who is a trauma survivor and they may have a employment or a housing related problem. And so we get some state money through that source. So it's a whole patchwork of funding that we try to, bind together to create a law office. So.
Right, and that wouldn't come from Don't Cut Us Out, Jossie, because that's very focused specifically on day programming, and we're gonna do a short update on that afterwards. But anyone else have questions? You can just unmute if you wish.
I have a question about mask wearing. So my daughter's in a out-of-district placement that rents space from a public school. And I'm concerned that when they go back to school, or if they go back to school, that may become an issue, that she can't wear a mask. And I'm concerned with transportation too. They've been very great now, but when, those students increase and they go back to the full public schools, what sort of rights does she have when that happens? If that question's asked, like she can't come to school, she can't transport without wearing a mask.
So yeah, it's a really good question, and we're getting these calls, almost every day now. And the short answer for you is, if that were to happen, I think you should just call our office and see if we can help you out. The longer answer would be this: that the law is I think in a somewhat unclear state. The Americans with Disabilities Act has what's called a direct threat exception. So if you are if you are a person that for one reason or another can pose a direct threat to yourself or other people, you may not be entitled to an accommodation to a across-the-board rule, like everybody has to wear masks. And so you would think that the only people who would be direct threats are people that we know have COVID, although in the employment context, the federal government has indicated that COVID itself triggers the direct threat exception. So, so we're all still trying to sort this out, I guess. One thing I would say is that it's clear that even if the direct threat exception applies, there should be some other accommodation that should be made. So for example, if I can't wear a mask for a disability related reason, let's say I have asthma and I want to go to the corner store, maybe I don't get to go in, but they have to come out and serve me, get what I need on the sidewalk, and bring me my groceries or whatever. There has to be some other obligation to try to deal with your disability related problem. Now, how that would play out in the context of school transportation, I don't think we have figured out yet, partly because the schools have not been reopening. I think some of the answers will start to emerge, but we would probably be willing to at least give that some thought and maybe be able to help you if the problem were to arise. So just call us and we'll see what we can do.
I saw, thanks Danielle. I saw today, and I just saw the headline in the Globe that guidance for fall buses came out. So I'm assuming it's regular ed. And I didn't read the article, but the headline was masks, socially distance, and windows open.
Right.
That's it. So we'll see, how that works. But I know a lot of people are starting to worry about the transportation.
And it's entirely possible that DESE or, in the DDS context, DDS will issue some guidance about how to manage our way through this, which is another way these issues could get resolved.
I mean, I remember we were very much worried about like if there will be testing of bus drivers and all that kind of detail. So hopefully that stuff is thoughtfully addressed. Let's see, we have
I
another.
have another line to go.
Okay, Jared, we'll see you later. We'll get you the slides. Don't worry. Okay, Jossie has another question. Jossie, do you want to unmute? We have time.
No, that's me. That's someone named Paula. That's not me.
Oh, you already asked that. I'm sorry. Okay, yeah. So paying for additional bus runs, Paula Collins. Who is paying for the additional run? That's a good question.
Yeah. I mean, I don't know if that will be the accommodation, additional bus runs. Maybe it would be something else. I mean, generally, the entity that's providing the accommodation has to pay for it unless it would be an undue hardship or a fundamental alteration. That's the ADA rule, but DESE or DDS can impose a higher obligation, that goes above and beyond that. We're really all trying to sort this out. As you know, there aren't any clear, bright line answers, at least ones that we have about that issue.
Absolutely. Okay, well, if anyone else has a question, they want to unmute, now's the time, because we'll let Rick go and we'll just jump in if anyone wants to stick around. Well, let's see. Is that it? Nope, I think everybody's set on questions. So Rick, thank you so much for joining us for this half an hour.
Okay, and Maura, one other thing I wanted to say, which is, we see everything that we do in our office, including the work that we do for people with intellectual and developmental disabilities, as being time and resources that we hold in trust for this community. And so what's important to us is to get feedback from you on what you think we ought to be doing and where we ought to be putting our energy. And there's two ways that you can do that. One is anytime through the year you can leave a comment in our website, and we read all of them, that says, hey, why isn't DLC, or could DLC be doing this or be doing that? This is a real important issue I'm seeing in the community. And then the second thing is we also have periodic dialogues, for lack of a better way to put it, conversations with the community about issues. And there's one coming up on the 28th of this month for people with intellectual and developmental disabilities and family members. It's on the 28th, I think at 11:30, and people can sign up through our website to participate in that. And again, it's just a conversation about what are the important legal issues facing this community that you think we ought to be working on. So either on that occasion or any other time through the year, please let us know your thoughts, and that'll help shape the work that we do. Okay.
Thank you, Rick. Is your website just dlc.org or
DLC-ma.org.
Okay, awesome. I'll stick it in the chat before we go.
Okay.
But
Thank
thank you again. Okay, have a great day.
Okay, take care. Bye-bye.
Okay, guys, I'm going to pop back to our slideshow here so we can run through just a couple of updates if you want to stick around for them. Last time I had trouble clicking my slides. There we go. Okay, so I just wanted to update people on Don't Cut Us Out. You've been so wonderful with advocacy, and I think we may have topped out on our numbers. And we're still getting some people writing to their legislators, which is great because negotiations are continuing. They've been ongoing since last week, and we are seeing enhanced billing. So that's a good sign. But without retainer payments, all the things that Rick and I were just talking about will not be possible. Any kind of creative or individualized or person-centered services, which is going to be so critical right now, given everyone's needs are different in terms of safety and their ability to manage, actually coming back or being back. So we're still really looking for retainer payments. And of course, a lot of this is dependent on the federal government, but we are looking for the state to continue to do more than just enhanced billing. So hopefully, I keep saying this every week, but the negotiations seem to continue. So we will have an update as soon as possible. And I think I have another slide later on that, you're gonna get these slides, but I put this in if you haven't seen our fact sheet that went out this week. I think it's really important for legislators to see this. We normally bombard our legislature with stories, family stories, personal stories, because we feel like this is the best way to help them understand exactly what's going on in the community. But we really know how busy our legislature is right now. I mean, I've talked to reps and senators who say they've actually never been busier than the last 2 weeks. And I personally know people were up good chunks of the night, the last couple of nights. So anyway, the point is, we put together a fact sheet with a personal story kind of embedded right in the fact sheet, just one, but it's very powerful. So if you can go onto our website, and you'll see our newest link is to Don't Cut Us Out, with a fact sheet that goes over a personal story and then gives some very clear bullets on why we need the day programming funded, and why we need flexibility in terms of possible retainer payment around those who are going to have to stay home, and how we can serve them best. So that's the Don't Cut Us Out update. Let me know if you have any questions on that. I wanted to quickly give you some really exciting good news. And I know we have Lisa on the line. She may already know this too, but the police reform bill is actually, as we speak, going in front of Ways and Means, and we have an amendment that was accepted, that was filed, and it's looking really good for our police training. So those of you that have been following the advocacy of the ARC or AFAM, this is a bill we've been working on for many sessions. And with this police reform bill, training police on the best practices and standards for working with individuals with autism and intellectual and developmental disabilities fits very well into a reform bill. So we were super lucky. We have an amazing champion in Rep. Paul Tucker, and he was able to take some amendment language that we sent over and just run with it. And then I got a call this morning that he was going to be speaking about this today. So stay tuned, because we did get a couple hundred letters sent just in the last couple of days around this from you guys, and you can still send letters to your reps, also on our website or on my Facebook too. So that's really, really good news, and stay tuned. The other potential good news is what we talked about earlier with Rick, is a hospital training bill amendment. And this one is still tentative because it's a narrower healthcare bill than we originally thought might be going through. But again, this amendment would create standards in training and best practices for healthcare professionals dealing with individuals with intellectual and developmental disabilities, focused on hospital professionals. So really good news if we can possibly attach that to any healthcare bills going through. I have not sent out any advocacy for this yet because it's still tentative, but as soon as I hear that the amendment was filed and that the bill is actually moving forward, I will send it out and ask for your help on that one. So we also touched on this earlier, but just wanted to, I know I'm keeping you a little late, but I just wanted to give you a little update on the great advocacy that the ARC US is doing. And I always put them on my slides for you guys to connect with them. But right now, I don't have an update on what the Senate is doing with the HEROES Act. But it's something that I know is happening right now. So good to check in on that. But the ARC of Mass's work, which is really been Leo's work over the last months, has been working directly with other states on advocacy that's needed to address the day program guidance, interpretation, and reimbursement. that didn't actually happen the way it was supposed to. So we had that meeting yesterday, and I think it was really effective to kind of teach the administration at CMS what really happened with those day program retainer payments. For us, we were unable, the interpretation was too narrow, and so really educating CMS on why, and I was able to give the family perspective as well. So hopefully we will see some movement federally on those back retainer payments that didn't come through from Massachusetts and other states. But that's a lot of information, and you can follow up with me on that if you're interested in learning more. But that's it. So I'll come back to some questions on any of those bills, or oh, thank you, Jassy. And there's the school bus. So Carrie put the school bus article in. Cracked windows, 1 student per seat. Interesting. So anyone have any other questions, or we can wrap it up? Feel free to unmute. Okay, guys, we'll stay tuned because there's a whole lot going on, and we want to keep you right up to speed and to get your help as much as possible as well. So thanks, everyone. I'm going to sign off, and have a great day. Thank you.